Hello and welcome to Newsmax Health. I'm John Bachman. Joining us right now from Detroit, Michigan is Dr. William O'Neill. Dr. O'Neill is a medical director at the Center for Structural Heart Disease at Henry Ford Hospital. And right now we're going to talk about a new procedure for implanting artificial heart valves. Thanks for being with us, Dr. O'Neill.
Thank you very much, John. It's great to be with you.
All right, we're going to give everybody a little bit of background right now. Not long ago, Dr. O'Neill knew that one of his patients, a 79-year-old heart patient, was running out of options. The man desperately needed a new heart valve, but was too frail for conventional surgery. In a world first, Dr. O'Neill and his colleagues at Henry Ford Hospital in Detroit created a new way to implant the valve, and the patient came through the procedure with flying colors. Now, Dr. O'Neill says the pioneering surgery could save thousands of other seniors who have been considered too weak for open heart surgery. Dr. O'Neill, it's good to have you with us. First of all, tell us about the background of the surgery which you performed on July 3rd. Had this patient run out of all the other options? There was nothing else you could do?
Yeah, she'd previously had an open heart operation with a valve replacement with what they call a pig valve. It's a tissue valve that replaced her own aortic valve. And that valve worked very well for many years. But unfortunately, the tissue started to become friable and started to fall apart, basically. So that valve wasn't working, and the patient was deteriorating very rapidly. There are other techniques of being able to fix it, perhaps open heart operations again, but she wasn't eligible. There was no way that the surgeons could go into her chest. And we wanted to put a valve in by a small cut in the side of the heart. And our surgeons actually went in and started to do an operation there. But once they got to the heart, there was no way that the heart could be opened and repaired, so we had to stop. And so she was in our recovery room and deteriorating every day. And so we came up with a new technique for being able to put the valve in by a new method of crossing from the main vein in the stomach across to the aorta, and then putting the valve up into the heart through the aorta and repairing. It's never been done before in humans, and it's actually worked very dramatically and very successfully.
How was this idea conceptualized? You know, there's the conventional way of doing things, and then you obviously came up with an entirely new way of doing this. Where did you get that idea from?
Yeah, I won't take the credit for the idea. A colleague of ours in Washington wrote an article in one of the cardiology journals where they'd done some animal experiments to show that it was possible in animals. And so there was some background idea of that it could work. And so we just took that idea that had previously been tested in the basic laboratory and brought it to the patients. It was basically an emergency procedure, and we explained to the patient and her family that there really wasn't any other option.
So how is the patient doing now since you performed the surgery?
She's doing great. It's just really been dramatic. She was in the hospital for a few days to recuperate, and then she went home to northern Michigan, and we saw her now. She's been almost 2 months out. Everything is healing. All the lines and everything that were put in are all gone. The hole that we made in the aorta is now fully healed, and we expect that she's got 15 years of good quality of life added to her life now.
That's remarkable, and I'm sure her family is grateful as well. Have you performed this surgery on others?
We're starting to very carefully look, since it's not a traditional procedure, we're really offering it only to people who have no other options. And we're being very careful. Having said that, we've already seen 6 patients that were candidates, and we've treated 5 others, again, with very good success. So we're going to be continuing to do this, and we're going to invite other centers around the country to learn how to do the procedure.
Now, there are about 5 million Americans who are diagnosed with heart valve disease every year. How many of these candidates, or how many of these patients, I should say, are candidates for this new surgery? What are some of the prerequisites?
Well, the illness that we're talking about is something called aortic stenosis, which is a narrowing of the aortic valve. The valve just doesn't open. And there are probably about 150,000 aortic valve operations a year that are being done, open heart operations. Many of those patients now can be treated with these non-surgical valves, except that in particular in women, the blood vessels in the legs are too small to allow the catheters to go up. So that's where I estimate that anywhere between 25 and 50,000 people a year in the U.S. and probably double that number in the rest of the world could be treated with this new technique.
Now, I know it's just been a little bit since you performed this first surgery successfully, and a lot of people who are watching this might wonder, when is it going to be widely available to everybody?
Medicine is very conservative. Breakthroughs like these actually take quite a bit of time to translate into other centers. We plan on working with the government to establish a formal registry so that we can keep track of how this is going. And I think it'll probably take 2 to 5 years before it's more widely available.
Well, still, it's a lot of it offers some hope for people out there who might have a loved one or might be in this same kind of situation themselves. It's very fascinating to hear how this was done. Dr. William O'Neill, thank you so much for being with us here at Newsmax Health.
Thanks, John.
And thank you for watching.